Welcome to our lesson on prior authorizations. The degree to which front desk staff handle prior authorizations varies widely. In some clinics, front desk responsibilities overlap with billing and other administrative roles. In larger settings, though, there may be dedicated staff whose sole duty is that of requesting and tracking prior authorizations for patients. If you're unsure about your own role, speak with your manager to learn exactly how much you'll be expected to do with them. Even if you won't be handling prior auths directly, it's important to understand them, particularly when it comes to scheduling patients. So let's start by defining what a prior authorization actually is. A prior authorization, sometimes also called a pre-authorization or pre-certification, is when the patient's insurance company requires approval before a specific service, procedure, or medication can be provided. In other words, the insurance plan wants to review the medical need for what's being requested before agreeing to pay for it. If you perform a service requiring prior authorization without first getting that approval, the insurance company can, and often will, refuse to pay, leaving the practice or the patient financially responsible. Before we get too far into this discussion on prior authorizations, let's first provide a little bit of clarification with respect to how they differ from referrals. Because especially for those who are new to working in the derm clinic, there's occasionally a misconception that the two terms are synonymous. A referral is generally a request from the patient's primary care provider, especially if they're in an HMO plan, which gives permission for the patient to see a specialist, like a dermatologist. Think of referrals as a provider-to-provider request, which is required by certain insurance plans for coordination of care. On the other hand, a prior authorization is a process which directly involves the insurance company itself, in which they require documentation and medical justification for a service, procedure, or medication before it's provided. So just to be clear, we're discussing prior authorizations in this lesson. You'll find a separate lesson on referrals elsewhere in the course. From the insurance carrier's perspective, prior authorizations help ensure that the proposed treatment is medically necessary, that less expensive or more standard treatments have been tried or considered, and that the patient receives the care which best fits within the insurance plan's rules and coverage limits. In dermatology, prior authorizations tend to be required when biologic medications are prescribed. These medications can be very expensive, so as a result, insurance carriers will tend to provide coverage only if the extent of disease warrants it, and only if other traditional, less expensive options have failed. High-cost procedures like photodynamic therapy or certain laser treatments for medical, non-cosmetic reasons are needed, or specialized surgeries like Mohs. But every insurance plan is different. While some insurance plans may not require prior authorization for a particular service or procedure, another insurance carrier will. With time, you'll likely become familiar with the nuances of each insurance plan's requirements, not just with respect to prior authorizations, but for other requirements as well. So let's go over the general stages involved in this process. The first is to simply verify whether there is a prior authorization requirement. Learning about any such requirement typically occurs in one of two ways. The first would be prior to the visit itself. Some insurance plans, especially certain HMOs or out-of-network setups, require authorization simply to perform the initial consult. These types of requirements are often discovered when the patient is scheduled, and the initial eligibility and benefits check is performed. If your position at the clinic will for the most part be limited to the front desk, then this may be the extent of your involvement with prior authorizations. Because the other type of prior authorization requirement is one which is discovered after the patient has been seen, and a specific procedure or medication is needed. For example, a patient may have been seen for an initial Mohs workup, which their insurance covered without any need for prior authorization. However, now that the decision has been made to move forward with excision, the surgery itself will need to be authorized. So once the need for a prior authorization has been determined, it's time to gather the necessary information. The first thing insurance companies typically want are the details about the requested service or procedure. This includes the diagnosis and procedure codes, as well as clinical notes which support the reasoning behind requesting the needed procedure or service. Again, this lesson is only intended to serve as an introduction, and some of you watching may not have much clinical experience, if any. So don't worry if you don't fully understand what we're describing here. But just as an example, let's say a patient was recently diagnosed with a basal cell carcinoma on the tip of their nose. Since the tip of the nose doesn't have much extra skin to spare, traditional excision, which takes out additional margins of healthy skin, would be difficult in this area. Instead, Mohs surgery would be the preferred choice. So, if we were completing a prior authorization for Mohs surgery, we'd first need to include the ICD diagnosis code for a basal cell carcinoma on the nose. Plus, we'd want to include supporting documentation, like the biopsy report, and exam notes which describe the location being the tip of the nose. The physician's notes will also probably include documentation of the discussion about treatment options in which it was explained how Mohs surgery provides the best option for excising the skin cancer while also